What is the most common cause of childhood hospitalization? Head trauma. What is the most common head injury in childhood? Cerebral concussion. In children over 1 year of age, what is the leading cause of accidental death? Drowning. What is the most common cause of limping in children? Acute trauma. What is the most common organism causing osteomyelitis? Staphylococcus aureus. During delivery, what is the most commonly fractured bone in the infant? The clavicle. What are the 3 most common screening tests at birth? Phenylketonuria, galactosemia, hypothyroidism. What are the most common organisms causing sepsis in the newborn? Group B Streptococcus, E. coli, Listeria monocytogenes. What is the most common congenital infection? Cytomegalovirus, CMV. What is the most common medical and surgical emergency in the newborn? Necrotizing enterocolitis. In the newborn, what condition causes herniation of the viscera outside the abdominal cavity and not covered with a sac? Gastroschisis. In the newborn, what condition causes herniation of the viscera outside the abdominal cavity and covered with a sac? Omphalocele. What is the normal respiratory rate for a newborn? 30 to 80 breaths a minute. What are the signs and symptoms of severe shock in children? Decreased level of consciousness, weak, thready pulse, no palpable blood pressure, capillary refill greater than 1 second. What is the stomach capacity of a newborn? 10 to 20 milliliters. What is an imperforated anus? Absence of the anus in its normal position in the perineum. What are the signs of increased intracranial pressure in an infant? Bulging or tense fontanelles, decreased pulse and respiratory rate, irritability, and vomiting. What is the position of choice when a lumbar puncture is performed? Side lying with knees drawn up. What is cerebral palsy? A neuromuscular disorder caused by an injury to the motor areas of the brain. What are the signs of rickets? Delayed closure of the fontanelles, delayed tooth growth, dental caries, deformities of the long bone. What are the observable signs of iron deficiency anemia? Pallor, irritability. What is the distinguishing clinical difference between anorexia nervosa and bulimia? Binge eating and bulimia. What should be avoided when giving care to a child diagnosed with Wilms tumor? Palpating the child's abdomen. What are the symptoms of aspirin toxicity? tinnitus, nausea, vomiting, difficulty in hearing, dizziness, diarrhea, mental confusion.